Our top story this hour, France has detected the first case of South Africa's COVID-19 mutant variant. And a French man who recently travelled to South Africa has tested positive for the mutant genome. He is currently under isolation. The case was detected in Hauteville region of France, close to the Switzerland border. The authorities say that the man developed symptoms upon his return. In wake of the recent spike in cases, French authorities have set up a system for detecting and monitoring cases of this infection or variant from passengers returning from the UK and South Africa. The passengers travelling from South Africa or UK are required to submit a negative COVID-19 test. The 501v2 variant is highly transmissible, experts say even more than UK's mutated genome. And the strain was detected by South African authorities in mid-December. Since then, Britain, Japan and Australia have reported the presence of the mutated virus. In December, France also reported the presence of UK's mutant strain. And for more on this, we're being joined by Dr. Julian Tang, Honorary Associate Professor from the University of Leicester. Thank you so much for joining us. More reports of the mutated virus have emerged, and you had mentioned earlier that it is not unusual. But would you think that what do you think could be the implications of this at a time when the increased transmissibility seems to be the major concern?
Yeah, so both the UK and South African variants seem to be more transmissible from the epidemiological data and the sequencing data. Again, we just have to comply with the COVID-19 restrictions more, just to make sure that this heightened transmissibility doesn't translate to more cases and more deaths and an overwhelming of the local healthcare services. So I don't think people need to panic about this. It's not showing more severity of illness. It's not likely to cause any problems with the vaccine. The vaccine should still work against both variants.
Yes.
But the main thing is to protect the population from getting infected, which may happen more quickly now with these variants.
Yes, I was just going to come to that. And for more clarity on this, now that you've mentioned it, do you think this variant could require a different combat strategy, or do you think the existing vaccines will be effective and enough for this?
I think the existing vaccines will be fine for this, to control this virus. But the main issue is to control the spread of the virus at the moment while we get the vaccine into different populations,
yes.
Both the vulnerable and the frontline workers.
All right. And how do you think, you've already mentioned that during the course of a pandemic, it's natural for a virus to mutate and adapt. What can we expect further from this now?
Well, more mutations and more variants may appear. There's one from Nigeria that's now being looked at by different groups, and there may be other strains arising from different countries depending on their different population mixes, how the virus is replicating in those different populations, whether they're on immune suppression or other forms of therapy that might create selective pressures for these mutations to arise. Yes. And of course, when we get the new vaccines, you may see some vaccine escape mutants appearing when a lot of people get vaccinated. And again, that's quite normal for other viruses like influenza and hepatitis B, for example.
And just for more clarity, do you think it can replicate into a more lethal variant? Is it possible?
Of course, it's possible. It's possible, but it's probably unlikely because if the virus kills more people, the virus can't spread that quickly. So the virus will generally not do this. Okay. But of course, some of the selection pressures that we impose on it from therapy and vaccines may actually cause this in some cases. So we have to watch out for those as well.
All right. Dr. Tang, thank you so much for joining us with all those details. WION is now available in your country. Download the app now. Get all the news on the move.